The content herein is for informational purposes only, not intended as medical advice, diagnosis, or treatment, and is not to be substituted for direct advice from your doctor.
Today's LymphCast program is proudly sponsored by VitaSupport MD, the makers of Vein Formula 1000 and Lymphatic Formula 1000. These MPFF-based nutraceuticals are backed by science and recommended by doctors specializing in venous and lymphatic disorders. Visit VitaSupportMD.com to learn more.
Well, greetings and welcome to our LymphCast show, episode 58 tonight, believe it or not, already up to 58. We are glad that you are with us. As a reminder, before we bring in the panel and get the questions going for our special guest, please visit our website early and often. That's lymphcastnetwork.com. Everything is there. If you have a question for any of the doctors on the panel, please email us at hello@lymphcastnetwork.com. Every show is on every podcast platform under the sun, and every show, if you want to see what we look like, is also on YouTube. So you can find us anywhere. Wherever you look, you'll find us. Let's go ahead and meet the panel tonight from California, Dr. Emily Eicher. Hello, Dr. Eicher. How are you?
Thank you, Paul, and thank you. Hi, team, a wonderful team. And I have the great honor to introduce our very involved and fantastic Adrien MacKenzie. She's a certified lymphedema therapist. She is a Bailana. She's a certified health and wellness coach, very involved in lymphedema world and education. And Eddie, so great to see you.
Thank you so much for having me. I'm thrilled to be here.
All right. Thank you for being with us. We'll get back to you in a moment, 80, and get the questions going. But first, let's bring in the gentleman who started this whole deal with the LymphCast show. He is also the founder and owner of VitaSupport MD. You can find them at VitaSupportMD.com. They sell Vein Formula 1000 and Lymphatic Formula 1000. From New Jersey, physician, surgeon, Dr. John A. Chubak. Hello, Dr. Chubak. How are you, sir?
Hello, Dr. Paul. Good to see you. I want to just mention, I want to echo what Dr. Eicher said and say it's wonderful having Adrien MacKenzie on the program tonight. We've been looking forward to this for a long time. But you made me think of something else, Paul, that I should take the time to mention. You mentioned that tonight is our 58th program of LymphCast, but I was recently on one of Dr. Paul Reeves' other websites and looking at Dr. Paul's Family Talk. And if I'm not mistaken, on that site and through Impact Radio USA, Paul, which you started some years ago, if I'm not mistaken, you have over 1,000 programs recorded. Is that correct?
It's actually probably closer to 2,000 if you go back. We started back in 2015 on terrestrial radio, opened this company in 2017. So yeah, it's probably closer to 2,000 by the time all is said and done. So we're moving and grooving. Yeah,
well, for all our listeners, Paul always gives me nice plugs and our guests nice plugs and Dr. Eicher nice plugs about the Lymphedema Center in Santa Monica, California, but he doesn't get a plug often enough. And tonight's his chance to get a plug because he's been an incredible voice on radio for many, many years and has done some outrageously good work and great interviews on Dr. Paul's Family Talk and the other programs that he does. So for anybody out there interested in listening to some great stuff, I highly recommend Impact Radio USA and Dr. Paul's Family Talk.
Wow, thank you very much. No, I didn't pay you to say that. We should make that clear.
Well, now you know. Next time we'll arrange something. No, just kidding. Totally unsolicited and unplanned. Now let's move on with Adrien MacKenzie. Thank you again for being with us. And Dr. Emily, do you have a question that you'd like to open the show with?
Well, we know each other with Eddie, and we meet at many different meetings, especially at the Fat Disorder and Research Society meeting, where we talk a lot about lymphedema. But there is much more to talk today with Eddie than just about lymphedema. So what I would introduce you and ask you, what got you involved in lymphatic disorders?
It's an interesting story. I came out of the music business actually, as a singer-songwriter. And as one of the things that I did to kind of, because I was not making tons of money, I didn't write big hit songs. I had a lot of fun and traveled the world, but I had the pleasure of doing massage therapy for a lot of people in the music industry in between. One of my clients was a breast cancer survivor who had upper extremity lymphedema, and she asked me to come and give her a massage and treat that, which I had no idea how to do. So she sent me a couple of journal articles. This was back in the day before the internet and everything. She like literally put a journal article in the mail and sent it to me, and I read it, and I went out to her home and tried to do what I understood to be manual lymphatic drainage. And I watched her arms soften and become smaller, and she reported that she felt better. And it was fascinating. And I always kept that in the back of my mind, that if I ever transitioned out of the music business, that I was really going to pursue that. And eventually I did transition out of the music business. Life caught up, and went and became a physical therapist assistant, and knew at that point that I wanted to specialize in lymphology. So I have done so.
Fascinating story. And do you have any challenges with yourself?
Yeah. So since then, I too have had breast cancer, but that's been almost 15 years. I'm very fortunate that my lymphedema is mild, manageable. It's improved since I've had a couple surgeries that removed some of the scar tissue that was left over from my reconstruction. So having that in a happier place in my body relieved pain and also relieved swelling. So I thought that was very interesting. So I don't, I acknowledge that I have lymphedema, but it does not have me. I definitely am in control of that.
That's fantastic. I'm going to jump in for a second because I like to go on some little tangential rides once in a while here on the show, because I think it's very interesting for me and for our listeners. The music connection, although I know it's not really it is tangentially related to how you got involved, because you were working on other musicians and so forth while you were a professional musician and touring. But I should mention, I don't know if you know this, Adie, but Dr. Paul Reeves is a very accomplished musician, formerly trained musician who ran some amazing band programs in the Detroit area and became a principal in a high school. His son is a professional musician. Music is something near and dear to Paul's heart. And Emily's children are both accomplished singers and involved in music and so forth. So I just think it's kind of an interesting connection that you all have. I don't have, my children are musicians too, but I'm not a musician myself. It's one of the things that I had very, very little aptitude for. But I wonder, we've had a discussion once trying to bring that full circle. We had a very nice discussion, Emily, if you recall, with Linda Ann Kahn, how important she feels music is in her therapeutic rooms while treating patients. And I wonder, Adie, if you have any thoughts on that.
I listened to that episode with Linda Ann, who I adore, and I do agree. I think that music is a gateway into emotional response, and you can do a lot of different things with it. If you want your clients to calm down, if you want to instill something more parasympathetic, you can use music for that. You can also liven the situation if people are getting too sleepy to be, learning what you need them to learn. You can use a little more lively music to help change that. But I definitely have to choose carefully, because some of the things that I find very soothing, some of my professional musicians do not, because they're very specific about the types of music that are tolerable or might be too associated with their work for it to be comforting for them.
Paul, do you have any thoughts about that, being so well versed in the subject of music?
In terms of
in terms of how you feel music might affect emotion and might be not that you're a professional in this area, but might have some role in a therapeutic environment, pluses and minuses, just thoughts in general?
Oh, I don't think there's any question about that, because every single person you talk to will have an opinion on music because it's affected them. Even if they don't even know what a quarter note is, they'll say, well, she's a great singer. That's a great band. They might not be any good at all, but to them they are, because it's affected them at the very core level, the emotional level. So I don't think there's any question about it. Now, like what Adie said, sometimes they need, I don't know if you said fast or to perk them up a little bit, and sometimes you need to calm them down. I can see that being a perfect tool for therapy. John, out of curiosity, do you have music playing in your office, like even in the waiting room when people come in? Or?
Yes, I have music all day.
I thought so, yeah. I thought so, yeah. Yeah.
And I think that it's not only important for, and I'm very particular about it. And there are a couple of things, and I think Adie said something that's the most important aspect of it. I think that clinicians should ask the patient, A, if they feel comfortable with music on, and B, if they have any personal preferences of what they would like to hear. Because, and sometimes I get agitated in the office if there's agitating music, because the work that I do requires great concentration and precision and a steady hand and just a sense of calm, that you don't want your blood pressure going up. You don't want your heart rate going up as the clinician, because this can affect your professional ability. Think about a professional golfer getting ready to putt. If there was all kinds of extraneous noise and crowd, trouble, or a professional tennis player serving, in those sports, that's become the routine or the norm, that they require complete silence at those key moments. But then you compare that, let's say, to a professional football game, and the crowd is going wild while the quarterback is trying, and that's become sort of a norm, and they cope with it or tolerate it. But if I call it the headbanger's ball, if suddenly the headbanger's ball starts playing in my office, not that I don't love rock music and everything else, all kinds of music, but for that environment, I find it very disruptive and very distracting and aggravating. And then I realized a long time ago, well, if I'm aggravated by certain kinds of music, maybe the patient is too. Yeah. And maybe I should ask them. And if they feel more comfortable, if they feel great with rock and roll playing, then I'll play rock and roll while we do their procedure. But if they prefer jazz or classical or just kind of elevator music, we'll do that too. The one thing that nobody ever really requests is silence, and I prefer that it's not silent either. I find it, as they say, deafening in that regard. Emily, how about you?
It's interesting topic. A few patients, when they are on compression pump treatment, they even bring their own music with them. And it's usually either elevator music or a classical music. And what's so interesting, talking about my Bianca, she loves opera. So when I get home, I have to, whether I like it or not, listen to her. And sometimes it's a little bit too much. However, she goes to convalescence home and she talks to elderly population, and then she sings the opera to them, and they just love that. They enjoy that classical music. So it's for everybody, for every situation, is a different aspect of music that they prefer. And it's so nice to see with the National Children's Choir, we just came back from Norway, the kids were singing throughout Copenhagen, Bergen, and Oslo. And it was incredible to combine geography, a history of different places with music. And I think it's so important to have that part in our life. And Linda N combines music for the patients with aromatherapy.
Exactly.
I think that is also a very important aspect in our type of setting, where we do a hands-on lymphedema treatments or lipedema treatments. The combination of that is very soothing.
Yeah. How about you, Adie? Do you have any?
Well, I was just going to say, there's so much emotional involvement when we have a chronic condition, and I know I've heard you address this before, that anything we can do to sort of temper the stressful emotions, to bring the emotions back into a realm that's going to be make a positive impact on the patient. So yeah, music, smells, the environment. And I have to say that I always warn people when they schedule with me that I don't have a treatment space that is a calming looking space. It's very crowded. You're looking at the calmest part of my treatment space. But with them being prepared for that and they're agreeing to that, generally people are able to come in here and focus and be soothed by the other environmental factors than the fact that I have a bunch of different devices and things in just a small space in my home.
Are you using aromatherapy?
Yes. But I don't have the clinical background with it that Linda Ann has. I want to take a class from her. I've been begging her for that.
I know, it's quite amazing. Well, the other thing that I wanted to touch on, Eddie, that you brought out, which, believe it or not, I don't think we've really talked enough about this. We've touched on it, but we haven't talked enough about this on the program. I'm going to let you and Dr. Eicher both talk to us a little bit about technique and expectations in terms of what proper manual lymphatic drainage is versus massage, so to speak, and should the touch be light or deeper, fast, slow? Because you do hear a lot of conflicting ideas on this. So I'd love to hear from both of you as experts.
Vein Formula 1000 and Lymphatic Formula 1000 from Vita Support MD are backed by science and sold in doctor's offices. If you're a physician who may be interested in prescribing or selling these excellent nutraceuticals, please call 862-246-7877 to speak to a representative today.
That is a great question, because I feel like when I went and trained to be a CLT in 2011, I had already taken another manual lymphatic drainage course. And in both of those, the touch was expressed to me to be very light, except if I was working in the CLT training, working on fibrotic skin. We used a different technique that was a little more aggressive, but it was really very light touch. And as I engaged in actually treating patients, I found that often I just needed to use more pressure than it was described to me that I should be using. And I found I've taken a little bit of training from Dr. Eicher, and I've taken now continuing education courses from a lot of different therapists. And I find that there's a great variation in the amount of pressure that's used in varying situations. What tends to be not different when we're talking about manual lymphatic drainage is directionality. So really having that sense of understanding the lymphatic drainage zones of the body and working to clear a congested area by moving in the appropriate direction, whether we have to reroute because the pathway to the natural drainage site is blocked due to trauma, cancer, surgery, or whether the person is simply formed in that way naturally from birth, that they don't have the lymph nodes there, they don't have the access, so then we have to reroute. But basically that directionality and the fact that the skin needs to stretch to allow the vessels to open and uptake the fluid. That's what I see consistent, but it seems like there's a huge amount of discussion around the amount of pressure and the style of the strokes. And that's been kind of exciting to hear and to see imaging of, to help validate some of the things that I did initially that I felt like, well, I'm probably going rogue by using this much pressure. But then I was able to see some of the studies, such as by Dr. Belgrado, where he was able to image people using more pressure and still moving the fluid. So
That's a great answer. That's very informative. Emily, how have you seen things change over the years with regard to pressure techniques?
Well, it's known that I have been in this business ever since my surgical residency. Actually, I started on my own lymphedema aspect, and then I progressed with more education in lymphology. And Dr. Belgrado is my personal friend, and I have been watching and studying with him all the evolution of the pressure that he is using. And he demonstrated with very precise pump sleeve where actually you can see through how the lymph channel is opening up and moving under high pressure, and it's not being disrupted. Years ago, it was thought pumps are bad, and it was kind of downplayed and put a pause on treatment with pump treatment. However, he demonstrated he went up to 120 millimeter mercury, which in my practice, I usually use about up to 50, 60 millimeter mercury. And again, it depends who is the patient and what is the medical aspect of that patient, whether it's lymphedema, lipedema, and so on. But with the indocyanide green, Belgrado and his team clearly demonstrated that the lymphatic system is not going to collapse under the larger pressure. And on the contrary, it is nicely moving when the lymph pump is in gradual, sequential, intermittent formation. And he has several different kind of pumps. And Edie is one of our representative for one pump that is being utilized as a not sedentary pump, but active pump. Active in the sense that the patient can be ambulatory and have the pump on, and it is demonstrating gradual, sequential, intermittent flux of the lymphatic system. So I don't know how many studies were done on the pump that you are in company with, and what is the efficacy of that. And I think this is an open field where we should be doing some study to see, is there any improvement when we have pump where the patient is ambulatory with the pump sleeve on, or is there a better efficacy when the patient is lying down, which is time consuming, as we know. And, it's also not only the pressure is the aspect. I see patients who are coming for consultation and they said it was recommended that they will use the pump 3 hours a day, which is, unbelievable. Who would even have the time today to be bedridden for 3 hours and using pump, whether it's on the arm or leg and so on. So there is an open field for studies to be done on number one, what is the pressure to use? And number two, what is the difference in the efficacy of the treatments when the sleeve is patient is ambulatory with the sleeve on versus patients who are bedridden or in a supine position using the pump?
So I want to respond to that just to say that unfortunately, our pump actually is not. I think you're thinking of the Aria pump, Emily, that actually that company went out of business. There's still the Koya pump. Yeah. And that's out there. And that is really interesting. And I haven't had patients be able to obtain it because of the DME rules of Tennessee. My people here in Tennessee, because there's no brick and mortar for Koya here so far, they were able to participate in a trial and they loved it, but they can't get it. They all felt like it was useful, but not, this is just what I heard anecdotally. They felt that being able to move around with the pump on was useful. It was nice. It was convenient for travel, but it wasn't as effective as being at rest with a pneumatic compression device that has more force. That was early in the advent of the Koya DaySpring sleeve, so it may be very different now. And I love that there's so much research going on. There was this presentation from Lymphatic Education and Resource Network recently where they showed that they're developing sort of robotic hand pieces that will do that same kind of Koya action right on the hand and foot. So I think that those things are going to be so important. But to your point, we don't know what the amount of pressure is going to be that's most effective. That the ability to titrate that per individual should be really important, because I saw a patient this morning who has an incredibly fibrotic hand with a very swollen dorsal hump. And she would need a lot of action. She would need a lot of pressure for that to be effective for that.
Well, we are much better today in terms of statistics and in terms of publications and research than 10 years ago, 20 years ago. It seems like in the past 10 years, it's an avalanche of so much research going on. And so, but still it's an open field. And I know that you are not only involved with lymphology, but also in lipedema world. So what got you into lipedema?
Well, I really was always interested in it. And I think that in my CLT, Certified Lymphedema Therapist training, I was not given a lot of detail about lipedema. That was in 2011. I don't think there was as much discussion of the diagnosis in those days. But I just became curious as I would have patients come to me who had that diagnosis or who had that presentation, and that I noticed I needed to do things a little differently than I did for my people who had more of the thicker lymphedema kind of tissue. When the pandemic happened, I had left the lymphedema clinic and I was working at the Center for Integrative Medicine at Vanderbilt and seeing a lot of patients who had so there I was working as a massage therapist for patients with chronic pain and chronic illness. And a lot of those patients had the diagnosis of Ehlers-Danlos disorder. They didn't necessarily have a lipedema diagnosis, but most of those women with EDS looked to me like they might also have lipedema, and I became so curious. And then when the sort of the information started coming out about connections there, and that connective tissue disorders being the realm in which both of those diagnoses fall, that they had a lot in common. When the pandemic happened, I focused on becoming a health and wellness coach and learning more about lipedema, and I got involved with Lipedema Simplified. So Catherine was very influential to me. Leslyn Keith has been an incredible mentor and friend. And through working with them and that incredible tribe of people who are involved with Lipedema Simplified, which gives so much hope and education and crowdsourcing information among the participants, it was exciting. And I've stayed involved.
That's wonderful. Emily, I want to ask a couple of questions. You guys are having such a great and illuminating discussion. Has anybody done over the years, if anybody would know, you would know, studies integrating lymphangiography with MLD to try to prove effectiveness and direction of flow and being able to redirect lymph flow in different directions and so on and so forth?
Well, I don't know any particular study, but the indocyanide green shows the lymph channels, the patency of the lymph channels, and it shows how it moves even when you do manual lymph drainage. And Belgrado did the study and presented it. I believe it was just now in the Istanbul. And in terms of lymphoscintigraphy, which shows us the anatomy of the lymphatic system, and first 20 minutes, the rate of flow, I don't think that it was correlated with manual lymph drainage, because again, what we have to do is not only inject a tracer, radioisotope tracer, and first 20 minutes you scan the body to see what the rate of flow is, whether it's the upper or lower extremity. And then the patient has to come back 2-3 hours later. And when it comes to lower extremities, we ask them to be ambulatory, not sedentary. So we see the progression of the radioisotope reaching into the inguinal area and periaortic lymph nodes, or for the upper extremity to the axillary region and so on. So I don't think that there is a study to do lymphoscintigraphy and manual lymph drainage efficacy. But with the indocyanide green, I think that would be fantastic study to do indocyanide green before and after. And as you know, I do a lot of studies on ultrasound, and what we showed with lymphedema and also lipedema patients, that after utilizing a compression pump treatment or just manual lymph drainage treatment on lymphedema, we may, lymphedema stage 1 or lymphedema stage 2, we may see some reduction, and reduction would be maybe up to 15 millimeter mercury in volume visualized on the ultrasound, 15% correction. But when we do combination of MLD and combination MLD with compression pump, we reach up to 40% in one session, 40% reduction. And I did study on lipedema in early adulthood, and it was stage 1, where we demonstrated 41% volume reduction in lipedema patient utilizing compression pump treatment. So there, if we would combine that with the indocyanide green, we will see the progression of the lymph system and perhaps where the blockage is. And that is why we have now combination of indocyanide green with lymph to vein anastomosis, where we know surgically where to correct, where to do the correction of the cross bridging from the venous to the lymphatic system. When we do the indocyanide green, it shows us clearly the patency and perhaps the blockage of the lymphatic system. And then at that segment, we can cross bridge with venous circulation that unloads from the lymphatic circulation and open the new pathway, fresh pathway to the lymphatics. And the efficacy of that is, again, how much do we have, how much lymph patency do we have in terms of anatomy or a blockage of the lymphatic system. Dr. Patel in Los Angeles area is well-versed doing these kind of treatments, but the efficacy is about 50-50. And it's not so much his superb technique, it is what he has to work with in terms of lymphatics anatomy or lymphatic blockage. If the patient has a very good lymphatic system, the chances of improvement will be there. And it's known, I underwent this procedure, and I had improvement in pain reduction, not so much in volume reduction, because I'm very busy, and although I am quite compliant with compression stockings and so, at the end of the day, with lipedema patients or lymphedema patients, you may see there is increased volume in affected limb, with increased activity, increased ambulations, increased standing and sitting and so on. So in the mornings, we are better. At the end of the day, we are a little bit more swollen. The lymph to vein anastomosis is fantastic procedure, and the efficacy is fairly good, but it's not always 100%, and we don't expect 100% improvement.
It's so exciting they can do it, though. I feel, when I was training, that all surgeries were bad. That was sort of the philosophy that was offered in my training program, all surgeries to address lymphatic dysfunction. And I think at that point, it was mostly discussion of the Charles procedure, but I feel so enthusiastic that there are surgeries now that are helping patients, that so many of the people that I'm seeing have a higher quality of life because of surgery.
Going back 30 years ago, even NLN said pumps are bad.
Yeah.
And I was using pump, and I didn't see any problem with that. But it was a phase where it was downplayed, the efficacy of the pump treatment, because they tried to do something different. So now we know, again, in the past 10 years, the evolution of the surgical technique and evolution of the research and studies. 30 years ago, we'd never heard of indocyanide green, and now it's commonly used. And I hope that it will be just the beginning of new changes in lymphology.
There's a very active team out of Australia that's been doing a lot of research with the ICG and mapping pathways. And I can't remember, it's Louise Kohlmeyer is the doctor there that I'm familiar with. And I can't remember exactly what ALERT stands for, but it's the ALERT program in Australia that has a lot of that research ongoing now. It's been really illuminating. I'm so grateful for that.
Dr. Belgrado, Jean-Paul Belgrado started that about 20 years ago. And at first it was, just like everything else, it was kind of skeptical approach from the colleagues. And now it is widely used and very helpful in terms of improvement of the lymphatic system.
Indeed. He's so brilliant. I met him, my very first National Lymphedema Network conference, the very first night. He was one of the first people I met, and I feel like a fangirl. He's a rock star as far as I'm concerned.
He among the others.
Yeah.
Yes. And we have in MD Anderson, we have Rasmussen and Dr. Aldrich. They published some studies on indocyanide green and the efficacy of the indocyanide green technique and improvement post-surgical intervention.
At VitaSupport MD, we believe in creating the best bioflavonoid-based supplements to support your vitality. Bioflavonoids are found in abundance in nature and support excellent health and wellness. The demands and stresses being put on our bodies in these challenging times are unlike any we have seen before. Support your body with the flavonoids it needs to fight inflammation and oxidation. Unlike other products in the marketplace, VitaSupport MD dietary supplements use micronized flavonoids for optimal absorption and effectiveness. Micronization is an advanced process which creates an ultra-fine powder easily absorbed by the body. At VitaSupport MD, we are passionate about making your good health our life's work.
Now that you mention it, is the ICG procedure, is that something that you could perform in your office?
Today I had a patient who had liposuction, and I started with surgery, and I still have a big part of my heart in surgery. And I only wish that I would have my office next to your center. And
I think we would do very well.
The surgical technique was with certain flaws, and it takes an artist to perform this kind of surgeries and also liposuction on someone who is a little bit more involved. And you, Dr. John, you have it. You have everything. You have the brain and the technique and the precision in your dexterity, and especially you care for these patients. And it's hard for me to see someone who had surgical intervention done in terms of lipedema, liposuction, and I go like, oops, it should have been done a little bit. And I only wish I could do it. So no, I don't. And I don't have enough space to do ICG. But then I have so many very, very involved patients. Today, I had a patient with head and neck and lymphedema. And I think it was because there was, during the surgical intervention, perhaps trauma to thoracic duct. And this needs to have a specific physician and also perhaps anesthesiologist involved when you do very involved cases. Upper extremity, lower extremity is quite simple. But when you do head and neck, that is a little more challenging. And in California, Dr. Stanley Raxon and his team, there are Center of Excellence where they have multi-approach with all the radiologists and everybody to address this kind of issue in very complex patients. As I mentioned, Dr. Patel at the Cedars-Sinai in Los Angeles area, he is doing lymph-to-vein anastomosis, and before that, he definitely administered the isotope indocyanine green to visualize where the blockage is, but he's doing it on the limbs, upper extremity, lower extremity. Head and neck is more involved, and it takes a specific center to approach these very complex patients. I wish that I had the facility to do the indocyanine green, but then it will only show me how efficacious my manual lymph drainage is, hands-on or with compression pump treatments. And I am happy to see some improvement with ultrasound. I don't visualize the lymph channels and propulsion of the lymph system through the lymphangiones, but I see enough efficacy after the treatment with ultrasound study. But in my dream, I will ask you to move to California.
In my dream, I moved to California too, out of New Jersey. But those are just dreams, unfortunately, at the moment. But one other thing, Eddie, I wanted to ask you about, and Emily, you can also give your opinion. You mentioned a term earlier that I think a lot of us are not familiar with yet, and just gaining familiarity with. You mentioned that you were working at a center for integrative medicine.
Yeah.
Why don't you tell us what integrative medicine is and how you would define that term? Because I think it's relatively new.
Yeah, I know functional medicine and integrative medicine and all these other wellness approaches that do not deny the importance of allopathic medicine as well. So the Osher Center for Integrative Health at Vanderbilt is the particular center that I worked at for 5 years. And they have a number of other centers around the world, mostly in the United States. And that center focuses on bringing together various forms of medical for allopathic, medical care, along with lifestyle interventions and wellness care, mindfulness practices. Some of them offer nutrition. In my case, I was working as a massage therapist, but needed to have the clinical background to be able to treat patients with really significant chronic conditions and chronic pain. And I think that a lot of the major medical centers, well, certainly in the United States, we interacted with other Osher centers, which were in Boston and in Chicago and in Florida. But I think a lot of other medical centers around the country are starting to have these facilities that will offer acupuncture and mindfulness, for lack of a better term, ways to self-soothe, hypnosis, just varying ways of managing pain that are prescription oriented. And lifestyle interventions that help patients, for example, the health and wellness coaching came out of my experience at Vanderbilt, because learning how to do that kind of motivational interviewing and determine small steps for patients to achieve their longer term goals and visions of their best self. That's the kind of thing that was being shared and focused on at the Osher Center, and still is. It's hard to find the right team, the good set of providers, at least when it comes to body work, the massage therapists with the background who can fit well in that setting.
Emily, I would think in California, integrative medicine is something that has probably been around for some time, correct?
Well, I believe so. But as you mentioned, during my consultation, whether it's lymphedema, lipedema, not only I do the physical examination, and when medically necessary, I do the ultrasound study to have the baseline of the affected limb. And then we talk about nutrition. And I am a co-author of the book, Lymphedema, Lipedema Nutrition Guide, among the 20 plus other physicians. And that is just the beginning of the basic for nutrition, especially for lipedema patients. And then I refer lipedema patients without failure to see allergy specialist, to see what foods are they highly sensitive to. And we have one patient highly sensitive to lettuce. Whoever thought that you can be sensitive to a food product like lettuce, celery, garlic, and the patients think that, oh, I'm doing healthy foods, preparing healthy foods, yet there is some reaction in the body, and the body reacts with increased swelling, bloating. And some lipedema patients tell you, I didn't eat anything unhealthy, but I gained 5 pounds after my dinner that I cooked myself. Well, if someone is highly sensitive to those foods, of course, there is going to be reaction from the body. Then during the consultation, we talk about exercise program, and the best exercise, whether it's lipedema or lymphedema, aquatic therapy is the best. And you have non-weight bearing, and if the patient has some joints problem, this would be the best. And again, we are fortunate in California to have a lot of swimming pools, YMCAs with swimming pools and so on. And then we talk about breathing exercises. And Linda Ann, fabulous Linda Ann, gave a talk about vagal nerve stimulation and diaphragmatic breathing and so on. How important it is to move the lymphatic system with breathing exercises. So this is all part of this. You can call it holistic, integrative, or whatever medicine, but to make the patient aware that there is hope, that they are not going to be stagnating with swollen limbs. And as you know, before, a lot of physicians, you say, you have lymphedema. Well, we don't have a cure for it. You just have to learn to live with it. On the contrary, there is hope, and there is going to be an improvement. But it takes not only a physician to be knowledgeable about how to treat these patients, but also patient needs to be compliant. And we have fantastic results when we have this mutual effort where the patient is compliant, wears the compression stockings, and does the nutrition aspect changes and participates in well-being.
And I think health and wellness coaching is one of the ways that we can help them find their why to be compliant and find the steps to get there. So that has worked really well for me as part of my, I mean, I know Linda Ann talks about being a health coach, and the training that I have in that, I feel like really helps me help my patients better. But you are a integrative health center all in your own small clinic, and that's beautiful. I wish there was more of that out there.
Yeah.
It helps to be the patient too.
Yes, ma'am. Yes, ma'am. Lived experience.
Yeah, helps to be compassionate. Well, Paul, I think we're coming to the end here, and I think that I'd like to give Adi one more opportunity to share with the audience anything that she thinks that we didn't ask or we should ask, or any last words of advice, wisdom, guidance that she has to share with us.
Well, I'm just thrilled to be here and to get to talk about the fascinating lymph system and all the things that can be done to help support it, and all the people out there doing that. If ever we get a chance to talk again, I want to talk more and more about pumps and all the things that they can do, because I know Dr. Eicher has been a fan of the pump for a long time. And I too, with Eros Medical, I've been really excited to get to help share that knowledge with people in a more effective way.
Yeah, and I'm a huge pump fan also.
Yeah,
I find them very effective, and I find them one of the most accessible devices for patients, many of whom have trouble with mobility, ambulation, very difficult time putting on any kind of compression, whether it's a stocking garment or even some of the Velcro and zipper devices that one would think would be much more accessible to patients. In my clinical experience for a long period of time now, nearly 20 years, I've found that the pumps are some of the most practical devices for patients who are otherwise limited. Now, for people who are highly functional and so forth, they can use their compression devices, garments, and so on and so forth. But just about everybody who needs it, I find, loves the pump, and I find pumps very effective when they're used. But I always tell my patients it's like brushing and flossing. We know that it works, but if you don't do it, you're going to lose all your teeth. So
just like your garments, if
yeah,
you don't use it, yeah.
The same thing. It's not going to be functional. I have two sisters who are dentists, and patients say, "Do I really have to floss?" And they say, "Only the teeth that you want to keep." So I often ask patients, "Are you using the pump?" And unfortunately, typically you ask that question when it's pretty obvious clinically that they haven't been, and most of them are quite forthcoming and honest, which is nice. But I tell them, if you use that pump, I think you can expect much better results. So I have certainly found them to be helpful and not harmful. I know we touched on that discussion today, and we've touched that on previous episodes, that there was a time where some experts believed that they could be harmful or detrimental, but I don't think that has borne out over the years.
I did some deep research on that, and there's just nothing. There are individual situations in which a pump is not appropriate, but in general, there's just no literature to support the idea that they are harmful in general. There's none.
And that's why we have these discussions, and we have the program to raise awareness, to educate and shed light. Emily knows, there were a couple of things that I found quite remarkable in the last 20 years as my practice has evolved in venous and lymphatic medicine. When I first started many years ago, I was absolutely terrified to do an endovenous laser ablation on somebody with significant venous insufficiency who had lymphedema, for fear of making it worse, because that was kind of the traditional teaching, that you shouldn't even put an IV in a patient who has lymphedema. You shouldn't take a blood pressure. You shouldn't draw blood. And over time, when patients were really sick and ulcerating, found it necessary to do some of those procedures, and then only found that we helped them and made them better, because so much of their lymphedema was what we now know to be lymphedema. And then Emily knows another dramatic program for me was when she brought her dear friend, Dr. Håkan Brorson from Sweden on the program, and to my amazement, was doing unbelievable liposuction on people with lymphedema, which again, I was also trained in my surgical training, could only make matters worse. And Dr. Brorson opened my eyes, at least, and made me a believer with his before and after photos, that when the lymphatic system is that dysfunctional, you really can't do any more harm. And then you have to get rid of that fibrotic tissue and fat and so on and so forth. So we're learning a lot as we go, right, Emily?
Indeed, indeed.
And I'm so glad that Emily loves to travel. So she goes all over the world and brings back the great new information to me. And I stay here in New Jersey.
Well, next time you can join.
I should.
There will be a fantastic World Congress of Lymphology next year, again in Turkey, southern part of Turkey.
Interesting. Well, with that, Paul, I think we're going to sign off and say goodnight and look forward to our next program.
That sounds terrific. We thank Adie. We'll give you a special send-off in just a moment. But we want to remind our listeners and viewers you've been listening to and/or watching and listening to our LymphCast show, episode 58. Please visit our website early and often. Everything is there for you, including all episodes. LymphCastNetwork.com. Email the doctors at hello@lymphcastnetwork.com. We are on every podcast platform out there as well as YouTube. Dr. Eicher, before I officially and legally thank you and Dr. Chubak, can you thank our special guest tonight?
It was an absolute pleasure to have you on LymphCast, and continue with your fantastic work, and we'll invite you back.
Thank you so much. I look forward to next time I see you.
The gentleman who started this, he also started and owns VitaSupport MD. They sell and make Vein Formula 1000, Lymphatic Formula 1000, VitaSupport MD. The founder of this show as well, physician surgeon from New Jersey, Dr. John A. Chubak. Thank you, Dr. Chubak, for everything.
Thank you, Paul. It's always a pleasure. I always learn a lot with each and every program, and I love this concept of integration, integrative medicine, and taking all of the resources that we have in all the different fields and areas of medicine and health and wellness. And as Emily said, as long as we really care about people and care about one another as human beings, I think that there's great hope for continued knowledge, awareness, and improvement of treatment for patients with these chronic and incurable disorders. But the more we talk and the more we meet one another and the more that we network with one another and make introductions, the faster that process is going to occur. So it gives me, great pleasure and great satisfaction to be a part of this program.
Very well said. And another great show. Again, it's been a LymphCast, episode 58. Have a great evening. We'll see you next time for a LymphCast, episode 59. Have a great night.